Austria has become the very first country in Europe to formalize a law that makes it compulsory for all adults to have a COVID-19 vaccine. President Alexander Van der Bellen signed the legislation in the past few hours. So from next month, police are going to start checking people's vaccination status. Anyone who cannot provide proof of vaccination will be asked to do so. They'll be given some time, but if they don't, they'll be fined $680. Our Europe correspondent Simon McGregor-Wood has a roundup of the latest news.
On Tuesday, Denmark scrapped almost all of its COVID-19 restrictions. The government said it no longer considers coronavirus a socially critical disease. Despite recording 50,000 cases a day, many of them the particularly infectious Omicron variant BA2, hospital numbers are down. So masks are no longer required on public transport or in shops, and digital passes are no longer needed for restaurants.
We have to check all the corona pass. We have one big line in front of the entrance for people getting in because we need to see the pass, and now we just throw it away and say, welcome everybody.
On Thursday, the normally cautious World Health Organization admitted that in Europe the pandemic may be reaching some kind of ceasefire for three reasons.
First, a large capital of vaccine-derived and natural immunity by Omicron. Second, a favorable seasonality pause as we move out of the winter. And third, a lower severity of the Omicron variant, now well established.
In the last week, the region, which includes 53 countries, recorded 12 million cases, the largest number since the pandemic began. But it hasn't translated into higher deaths or into an urgent medical care crisis.
Hospitalizations continue to rise, mainly in countries with lower vaccination uptake in vulnerable populations. This rise, however, is not as rapid as the case incidence rate, and overall, admissions to intensive care have not increased significantly.
Across the continent, countries are following the Danes and the British, who were the first to experience the Omicron surge last November. Some may be going slower than others, but once health systems no longer need protection, it's harder for governments to justify restrictions. The World Health Organization warns new variants will almost certainly emerge. Countries should be cautious.
Those countries who are making decisions to open up more broadly also need to be sure they have the capacity to reintroduce measures with community acceptance quickly if needed.
Getting vaccines into developing countries is still an urgent priority. So too the need to finish the booster process. In Europe, the beginning of the end may be in sight. But for as long as millions remain unvaccinated around the world, this global pandemic still has the capacity to deliver nasty surprises. Simon McGregor-Wood, TRT World.
I'm sure you know Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School. Doctor, welcome again. Just to pick up on what was in Simon's report there, what's your assessment of the WHO's analysis that Europe may be reaching some kind of ceasefire with the virus?
It very much looks like it. So we've gone through our surge in case numbers. And the good news is that because the European nations are heavily immunized, even boosted, it hasn't resulted in hospitalizations and deaths. And therefore, now is the time to slowly ease the brakes and remove the restrictions. But as Dr. Ryan at WHO just said, we need to be careful just in case if we have to reapply the brakes come in the next few months. But the next few months are very much favorable for European nations.
Yeah, absolutely. We're talking about some of the richest countries in the world, some of those who have been lucky enough to have plenty and plenty of vaccines. And in those nations, right now, it does appear that more and more children are being infected than at any other stage of the pandemic. Many of them are unvaccinated. In the UK, thousands of them have already developed long COVID. Are children being forgotten here in the name of a return to normality?
It feels like that, and I've been a proponent of prevention and protection all my life, all my clinical life, 30 years plus. And it is curious that the United Kingdom has been out of step with the European nations and United States and Canada in not assiduously immunizing children. I feel there is much more to do with regards to public health measures, which is even if children do not get severe illness, many of them still get hospitalized and some die. Therefore, I'm very much in favor of immunize, prevent, and protect.
3 billion people around the world are still unvaccinated. The majority of them, the vast majority, live in low to middle income countries. South Africa has just developed a homegrown vaccine that is based on Moderna's vaccine, but they had to use publicly available data because the American pharmaceutical company refuses to share its formula. Can other countries do what South Africa has done?
I was so pleased to hear the South African news, and I hope that international scientists all over the world will collaborate and beat the pharmaceutical companies at their own game, which is reinvent the vaccines. It is such a tragedy that Moderna, Pfizer will not use their technology, considering they were funded by public money, to waive their rights on intellectual property rights, patents, and allow the manufacture of these vaccines. I hope South Africa will be successful. And if they are successful, it will be a really good day for planet Earth.
Doctor, I just wanted to end by saying, you know, usually our viewers see you sitting in a lovely living room in the city of Bath, where you obviously live, and those beautiful paintings behind you. But you've come to London, and we know that you're too smart a man to come in the studio and sit next to me because of the dangers of us breathing on each other. Who knows what can happen? We still have to be extremely careful. You help all of us. Dr. Bharat Pankhania, thank you so much.
Thank you.